Welcome back to MDTV. Here we go. We're kicking off another episode, Friday, March 13th, and let's get into it. So, what I did here is I actually created this graph, and I did so using the worldometer data that I had discussed in previous videos. And what I did here is I marked the first dot for each country when the first case appeared or was reported in the country. So we know that China, the first case to be identified and reported was mid-November, but officially they have the first report around December 1st, even though it did pop up a little bit before in November. However, look at this lag time between December 1st and this first point right here when the number of new cases per day really started to take off. Okay, so this is almost 2 months, over a month and a half before the number of cases or reported cases, that is, started to take off. And then it wasn't until just after February 20th when China started to see a decline or a leveling off, if you will, of number of new cases per day. Now, one thing to note is that these graphs are not drawn to scale. So the real curve, you have to understand, is going to look something like this. If we start over here, December 1st, the number of new cases are really going to go something like this, and then we'll sort of level off here. So my prediction is every curve is going to have sort of a sigmoidal shape to it when it's all said and done. So it's not like all of a sudden on January 20th these cases just shot up like this in one steady fashion. It's just that by the time it took for us to identify what was going on, there is a delay there, okay? And who knows if the amount of cases are truly contained in China. It's stayed at 80,000, pretty steadily for the last couple of weeks, or around 80,000. But we don't know who they're testing. Are they massively testing like South Korea? The answer is it depends on what province you're in, but largely no. So we really don't know exactly what the containment is in China. We just hope that we can believe the data, which says that it has leveled off around 80,000. So we can use China as a model to make predictions about these other countries. So the first U.S. case reported was on January 30th. Right here, okay? This is in addition to Spain. We both had cases that started or appeared on January 30th, and it wasn't until March 2nd when we really saw this thing take off. Okay, the number of cases increasing per day. Spain is up to, let's see, that's just over or just under 10,000. USA is above 2,000 and counting, and so on and so forth. So one thing to note is that you can tell by the amount of lag time before we see this giant spike in reported cases. I feel like that is a good indicator as to where this might go or where we're at today. So if China had, this much time and USA had about this much time, how much do we expect this USA curve to change, right, before we level off? Now, look at South Korea, because South Korea is the only country that has been able to effectively reduce the number of cases per day and contain this. So they had their first case report around January 20th, so about 10 days before the US. They had this amount of lag time period here, and then they see a jump in cases on February 20th. But look at this. March 1st, or right at the beginning of March, Korea sees a leveling off of the number of new cases. I think that they're up to 7 to 8,000 today. Um, but the question is, with this much lead time, South Korea was effectively able to reduce this rate of increase. Okay, so I think, again, going back to the US, if we see a similar lead time to South Korea, maybe a little bit longer, then how do we ensure that our curve here follows South Korea? Well, what did South Korea do? South Korea um, massively quarantined positive patients, and they massively tested everyone. They are the country that has tested the most amount of individuals. I think it's close to 300,000 people have been tested in South Korea. Whereas other countries besides China don't even come close to the amount that they have tested. This will change in the coming days as more and more countries begin to ramp up their testing measures. But South Korea really was the first country to get ahead of this, and whatever they did seemed to work. But I think it's interesting when comparing the response you see here in China and analyzing their timeline and their curve. Remember, the real curve follows more of a sigmoidal shape like this. Um, so, how do we ensure a fall off in the USA as we saw in South Korea and then eventually China? That is the question today. Tune in for the next episode. We're going to go over death rates and much, much more. Thanks. Welcome back. All right, let's jump right into death rates. So, it's interesting to note as more and more data comes in, we're seeing just a steady increase of number of new cases per day, as well as deaths per day. And it's interesting that every country has a different death rate. And why is this? Why would some countries have such high death rates, such as Italy, versus countries such as Germany and South Korea um, have such low death rates? Well, I think the encouraging news is that the more and more people that are tested for this and test positive for this, the more we're going to realize that the death rate is going to be lower or lower than 1%. Because if you're not testing massively and you're only looking at a more sick population, then artificially your numbers are going to be higher for death rates. Okay, so I think that this data is encouraging that we see death rates lower than 1%, USA about 2%. And I think this gives us an idea of the amount of testing that is taking place in the country. Now, there's caveats to this, such as I know that one of the populations that was hit in Italy was a severely elderly community and city. And so, of course, this is a virus that attacks disproportionately the elderly population, and so therefore they're going to see higher death rates because of that. And of course, other indicators in other cities around the world. How old is that population or that city? What's the smoking rates? What's the underlying health status, and so on and so forth. But I think that the data we have so far is encouraging in the sense that despite China and Italy and Iran having very high death rates, you see other countries who are testing more individuals that have lower death rates. So there is hope in that regard. Now, I want to explain how the coronavirus is transmitted. Okay? It's important to understand that this virus is extremely contagious and it is infectious in the air. It is the air that is the most infectious, and you breathe it in and the virus gets into your lungs, gets into your blood, and starts to cause havoc. So That's the main entrance into the body, is through respiration. Now, how do you avoid infection? Well, there's only two ways to avoid infection. That is, you either don't come into contact with anyone that has the virus, or if you do come into contact with an individual that's infected, then if you have immunity, you most likely will not get infected. Okay? And of course, you gain immunity through vaccinations. All right? Now, so let me point this out of how exactly this works. Now, the virus lives all throughout this respiratory tract here, okay, in the lungs. And every time this guy breathes in and out, he is breathing virus particles into the air. Okay, we're going to use red as the most infectious, and orange as semi, and then yellow as not quite as infectious. So, as this person, infected individual, is breathing into the air, he's breathing these particles into the air. And as more and more space goes out, these particles start to diffuse and become less infectious, okay, as these diffuse and other air coming in mixes, right? So the farther out you are from this individual, then the less likely you are to acquire the infection. All right. So this goes to show you that if somebody's coughing and really forcing air out of their respiratory tract, this is going to increase um, the quantity as well as the velocity of the particles coming out of the respiratory tract. Okay. So the common everyday surgical masks you see people wear, they are absolutely effective only if the individual is infected with the virus, because if this guy coughs or, God forbid, sneezes, that mask will be able to catch a lot of this and prevent this giant cloud going into the air. But unfortunately, the virus is small enough to where it can still actually get through this surgical mask and infect people. So it's good for infected individuals, but not so good for people trying to prevent acquiring the infection. Okay. Another thing to understand is that air molecules travel at about 1,000 miles per hour. Okay. And again, this kind of just goes to show you that as you get farther and farther away from the contagious person or source, then these particles are constantly just diffusing and flying everywhere. And there's something called infectious dose, and that is if you are breathing directly in and out of this guy's mouth, if you are standing here and just breathing face to face with this guy, the likelihood of infection is so much higher because of this increased infectious dose versus someone standing farther away, where hey, oh, they may get slapped with one of these particles, but one particle is not enough to actually infect you. You have to be infected with a higher concentration than that. But the point is that these infections are extremely contagious the closer you are to the source, and the more amount of people that you have with the infection, the larger cloud you build that is infectious around the individual. Okay, so another way of looking at this can be if you have an individual represented by a dot, and we'll make this individual infected here, then at what radius does this individual become safe, right? So unfortunately, we don't actually know. We don't actually know. And again, the yellow colors are representing less infectious as you get farther and farther away from this infected individual, and the closer you are, the more infectious you are. Okay? All right. Now, what about hand washing? All right. Well, hand washing is absolutely necessary because as these particles travel throughout the air, they are landing on surfaces and landing on clothing, and they can live, whatever it is, 12 hours, 2 days, or less, depending on what the surface the virus lands on. But imagine a healthcare worker that is coming into contact with all these patients. Imagine the healthcare worker actually manipulating the air tubes of these highly, highly infected patients. Imagine how much of the virus is going to be on that individual's hands. And of course, hopefully, the healthcare workers are wearing gloves at the time that they're manipulating these airways of these sick individuals. But they are going to have super, super high concentrations of this virus, all over their hands, maybe their body, whatever. And because the air molecules are constantly moving in every which direction throughout the air, it's going to, blow some of this where you're going to be able to quickly breathe this in here. So, despite the fact that this virus is transmitted through the air, it's also important to have good hygiene practices to not, spread this elsewhere, and to not basically be carrying around these little petri dishes that, if you do wipe your eyes here with this, that's another way that you can get infected. So, understand how the virus is transmitted through the air, but also understand the importance of washing your hands and cleanly surfaces around you. But the last point I want to make about this is in regards to an airplane, and you may see, let's say that this is an infected individual here, but we don't know that that individual is infected, and I'm sitting in this seat right in front of this individual, and I am just going to town with sanitizer. All right, I am wiping everything, every surface, every TV, and I am trying to build this box, and I just feel great about myself because my hands are clean and every surface is clean around me. Well, remember what we said about that airspace and how infectious that is. So regardless of how well things are sanitized around you, I mean, this infection is spreading through the air. And imagine if this individual sneezes on this airplane, there's nowhere for the air to go. Okay? This virus is just going to be just circulating through this plane like that. Okay? So bear that in mind. And lastly, to sort of bring this to scale, I really like representing how infected individuals are by the radius around them. And so let's just take an example, like in California, for example. If you have just these it'll start out with these little tiny dots. Let's make this in red so it's easier to understand. You'll have these little tiny dots, right, of infected people. They'll be smaller, but then, like, as more and more people in the community get infected, all of a sudden you're just going to have one large infectious cloud. And I'm kind of dramatizing this, but imagine working in a hospital with all of these infected patients, and imagine just the infectious nature just surrounding that entire building, or within that entire building. It's just a cesspool of infection. So just bear all of this in mind when trying to understand how this is transmitted and what precautionary measures you need to take. And we'll end with this map right here. This just shows you where the infected individuals are. This is a map created by Johns Hopkins, and it is current as of March 13th, 2020. Thanks. Welcome back to another episode. Let's jump right in this. So, you may have seen this graph before, and I want to make a couple remarks regarding kind of what we have learned in the recent days and what sort of predictions that we can make moving forward. So, as we have stated, our coronavirus is down in this lower left quadrant here. Okay. And there's a couple things that you can learn from this. I'm just going to make this smaller. There's a couple things you can learn. All right. We know this virus is very contagious. We know this virus is similar to a flu, right? So here's our seasonal flu. But it's more contagious than the flu, right? Because the farther you go to the right, the more contagious you get. We're just going to continue to blow this up here. And the higher you go up, the more deadly, meaning out of 100 people, how many of those 100 will die? Okay? So coronavirus is around 1% as of estimates of today. We will most likely see this number decline, but the question is how much, and we don't know for sure. Okay? So keep an eye on the seasonal flu here and how many people this kills per year. And the answer is somewhere between 200 and 500,000 people. To have nice even numbers, we're just going to say 500,000 deaths. Swine flu. Swine flu was very similar to the seasonal flu, but no one's vaccinated, nobody has immunity, so it spreads like wildfire. It's more contagious, slightly more deadly, but pretty close. And this was also responsible for 500,000 deaths. Okay? Spanish flu. Spanish flu is just very close to the upper estimates of this coronavirus. It's very similar in regards to how contagious it is, right? And it's almost closest, at least the upper estimates, to the death rate. Now, I think that we're going to see the death rate hopefully decline. The Spanish flu, I think, was estimated around 3 or 4% of 100 people died, and coronavirus is 1, and hopefully less. But how many people did the Spanish flu kill? Well, 100 million. 100 million people. And if we're saying that these upper estimates are closest to the Spanish flu, well, there is reason for concern, folks. Yes, there's been extreme changes in medicine from 1918 to 100 years later, but in terms of strictly the viral properties of what this possibly could do, is it could turn out to kill a lot more people than what is currently reported or where it's at today. So this is not to scare anybody. This is just to say that we have to kind of look at our history, our previous pandemics, kind of best try to classify this virus. It is transmitted very similarly to the flu. It infects like the flu. And so you can sort of draw similar conclusions about the potential of this, right? And so if in fact the virus is more contagious and more deadly than swine flu, and swine flu is responsible for 500,000 deaths, then one would logically conclude that the coronavirus will ultimately end up somewhere between this 100 million and 500,000 range. Now, it doesn't mean that that's going to happen. That just means that that's what the potential of the virus is. So you got to be careful. It's not to say that this is going to happen. I want to make that clear. This is not necessarily going to kill this many people. But it's important to note that it's possible. And if in fact the viral properties are similar and are even closer to the Spanish flu versus the swine flu, then this, shifts the possibility of getting closer to being more deadly. Okay. And again, I want to just reemphasize the fact that in 1918, I mean, the healthcare just wasn't there. There was no such thing as ventilators. People didn't understand the spread of infection and germs and all of that. So there's been dramatic improvements. And the bottom line is coronavirus is not going to kill 100 million people. I mean, at least we hope, and I don't think that it is. But it's just important to know the similarities between the viruses, what the potential is, and then utilizing what we know now to really get this number down and make sure it stays down through things like quarantines and so on and so forth to really stop the spread. All right. And this is just kind of emphasizing those numbers. Where we're at today with the coronavirus, we're still floating around 5,000. This is getting closer to 6,000 here. And I just kind of rounded these numbers to even them out. And you can see seasonal flu is, as of today, 100 times worse per year. Swine flu, 100 times worse. And can't do math that quickly in my head, but Spanish flu was significantly worse in terms of the amount of people that have died. But just be aware of those viral properties of what this is capable of. If in fact this is true, we really don't know exactly where this virus lies, okay? But it's going to be somewhere here. But just be aware of what this potentially could do and why we need to be smart about our approach. All right, so this is just showing the same thing, deadliness on the y-axis, and then this is actually the amount of people that these infections have killed, and we see, HIV. This is per year, by the way, so one pandemic like Spanish flu is not going to be on here, but you see seasonal flu, you see HIV, you see noro, you see chickenpox, shingles, swine flu. It's still killing today. So the whole idea, the name of the game, even though coronavirus is going to continue to increase the amount of deaths, there's measles, we want to slow this number. We don't want this shift to keep going to the right. All right. And shame on anyone who is an anti-vaxxer, because all of these out here are preventable. We have vaccines. It's inexcusable that this is allowed. This accounts for millions of deaths per year worldwide. We're at 5,000 today with corona. And these pathogens are preventable, and it's inexcusable that they are responsible for so many deaths per year. So while we're considering what the potential of coronavirus is, think twice about skipping your flu shot and just pay attention to the severity of the infectious disease burden on society as a whole. All right, I want to leave you with some optimism here, and this is a slide that I took from Valuetainment, Patrick Bet David. Brilliant man, look him up on YouTube, but this is just going to show you that at 6 months, this is the S&P at 6 months after the pandemic break, and this is the MSCI. The markets largely have responded very well, okay? 6 months, 12 months. You can see all green numbers here. So the likelihood of our market bouncing back and us having money in our pockets is very likely. All right, have a great day. Stay safe.